Mattacchione has become a good friend, and he's a regular here. Rob Mattacchione is the CEO and board chairman of a company called Novo Integrated. They are publicly traded under the stock symbol NVOS on the NASDAQ. But what he brought to light was this thing called decentralized healthcare, which means that, well, you have kids. How much time do you spend per year going to the doctor, and then how much time do you spend waiting in the doctor's office?
Well, a lot, actually.
Right?
We have one coming up this Monday, and it's a pain because scheduling it with our schedule with school and dance.
And I can tell you, Mary's a little bit of a freak about germs and stuff like that. I don't mind saying.
Just a little bit.
So here's my deal. How do you feel about plugging something into your device, taking your own blood pressure, or being diagnosed through the computer? Would you be
100%?
You'd be okay with it?
Yeah, I already bought the COVID home test. They're in my house.
Here to talk about that, my good friend Rob Caddy. Rob, aren't you glad we have some brains on the show today, versus just me and Russ? Great to have you, pal.
Yeah, great to be here, and it's such a pleasant relief and refreshing.
I know.
Has he been on your show?
No, but I've already thought I'm going to poach you for America Trends, so let's talk.
We need to get him on your show.
Yeah.
So, hey, Rob, give us a top down again, and we haven't done this for a while, on what decentralized health is, because we're used to going to the doctor and seeing our doctor. That's not decentralized health. Decentralized health means we don't go to a central location. Talk about that a little bit.
Yeah, it's a bit of a throwback, really. It brings us back to our roots, right? When doctors came to your home, and healthcare was a feature that was dealt with in a very comfortable environment, which was typically your home. We're not discounting the fact that these centers are needed, and you need to be able to get out every once in a while when things become a little more serious. But for what we call primary healthcare solutions and more of a wellness approach, home personal application to health is absolutely essential, and that's really what we're promoting. And we want to have always the connection to sophistication around healthcare, and that's where these centers become important, and even smaller centers, so that we can integrate a real broad approach to servicing the entire community, not just those that can reach healthcare easily.
Hey, Rob, I got a question for you. So the pandemic hits, and one of the grotesque realities of COVID is that some companies benefited, and yours was one of them, because this pandemic highlighted your business model. And like it or not, the way it sounds, it actually kind of pointed out the fact that maybe we should change the way we deal with healthcare. Correct?
Yeah, Sully. It is unfortunate that we need these types of circumstances to come up and make certain things a reality. It's the one time that we shouldn't be ashamed of profit, because it brought an awareness to a model that's absolutely necessary, and technologies that we need to embrace to deal with just everyday
to do telehealth.
Yeah, exactly.
I was wondering about the medical technology to make this accessible and able to do. Are we there yet?
Yeah, excellent question. We are there. I think that we can be better. I think we can adopt even more sophistication, because it does exist. But we're definitely well on our way to having a fully comprehensive solution that is tele-based. And we just want to make it a little more sophisticated, and that's what we're about. We're about enhancing that experience and speaking more to it in terms of the way Sully described it, more peripheral, so we can get a very accurate diagnosis and actually come up with some proper treatments.
So during COVID, I do remember having an appointment, and it was with my dermatologist.
I thought you were going to say I remember having 6 masks on.
Yes, I did have 6 masks on and took tests frequently. So also I had an appointment for, something on my skin. I didn't know what it was. Of course, I thought it was cancer right away. But I was easily able to take a photo of it and send it to the doctor, and then she was able to see over the computer and tell me, you're fine. Just come in when COVID is not such a big thing, and we'll get that removed. It was no big deal. So is that where we're at, or can it go deeper than that?
Yeah, we're definitely there now, and we're actually even one step beyond that. A lot of the peripherals that we're utilizing are actual, deep tissue peripherals. To your circumstance, we would have been able to get right into the derma and figure out if there was something more than just something that you could see from a top view of the picture. So the peripherals are incredible. The technology is phenomenal, and it's advancing literally every day. It used to be we'd wait 5 years for a new advancement. It's monthly now that we're adapting to new tools, and it's exciting. It's a truly phenomenal time to be a patient in a healthcare environment.
His name is Rob Mattacchione. He is the CEO and board chair of a company called Novo Integrated. They are publicly traded under the stock symbol NOVO, and of course their website, novointegrated.com. One last question, Rob, because many times we go to the doctor as a reactive solution as opposed to preventative health care. This really solves that problem because suddenly, here we are being able to do preventative health care right from our desk at home, correct?
Yeah, well said, Sully. And really what it also does in terms of that preventative mindset is it conditions us to care about ourselves. We've always kind of fluffed it off to the doctor or to the practitioner that we're engaging with. But now we're an active part of it. And when you do that, you then hold it and own it yourself. And there's no excuses why we shouldn't care about our health as much as we do about the things that we buy and maintain.
Yeah, well, I'll tell you what, Rob, you need to be on America Trends. There's more people need to hear about that.